Now, how many people in here know what a certificate of need is? Okay, we got a couple, but I'll give you a little bit of a background. Back in 1974, Congress passed a law that said to each of the 50 states, if you want to continue getting money from Medicaid, or if you want to continue getting money from Medicare, we need you to pass a certificate of need law, or you don't get that money. So all 50 states passed a certificate of need law. Now, what does that say? It is a requirement that if you're a health care provider, whether you're a hospital or some alternative care provider, and you've got capital that you want to invest to provide health care services, you can't just go out there as an entrepreneur and do it. You've got to go to the public health agency for the state, which in our case is the Department of Health and Environmental Control, and you've got to demonstrate to DHEC that there is a need for that particular health care service in the area that you want to provide it. Now, the problem is this, that once you have 50 states with certificate of need laws, you have certain existing healthcare establishments that get that certificate of need. They get that important piece of paper, hospitals, other healthcare providers, and whenever somebody else wants to come into that space and provide healthcare services, they fight the issuance of a new certificate of need authorization to the new provider, right? Because they want to protect what they have. And they typically make the argument, they say, well, there's no need for a new facility to come in here because we can expand what we're already doing, or we can buy some more equipment, or we can hire more doctors and nurses. And so it's very difficult for a new entry into the healthcare space to satisfy and make the certificate of need, that certificate of need case. Okay, so you don't have the competition in that healthcare space. And even if a new provider was fortunate enough to get a certificate of need, the existing providers would typically appeal it and tie it up in court for sometimes in 10, 15 years. I mean, the horror stories are there. So what began as an attempt by Congress to think, well, this is how we control healthcare costs by requiring a certificate of need, it actually didn't do the job at all. It cut off all competition. It cut off new capital being invested in that space. And so Congress repealed that requirement in 1982. But by then it was too late. You had 50 states with CON laws, and you had stakeholders, existing providers, that benefit from that law. So it's very hard to dislodge a law like that that's in place, and you've got a specific group of entities that benefit from it. It's the phenomenon of concentrated benefits and dispersed costs. Whenever a state law or any law confers benefits upon a finite group of stakeholders, they hire lobbyists. They have the ability to engage in the political process. They lobby to keep it in place, okay, because the benefits are concentrated upon them. The costs of that are dispersed among all South Carolinians because they don't have the benefit of alternative providers, competition in the healthcare space, because intuitively we all understand, right, that if a provider has to compete and if a patient has choices, that dynamic ultimately is going to lead to lower costs and a better product. We've seen that market principle work across all sectors of our public policy. But it's very difficult to overcome the bias that's now in place. 12 states were able to repeal their CON laws after Congress in 1982 said it was no longer a requirement. And we can look at those 12 states and we can empirically see that healthcare access has expanded in those states and costs have gone down. I mean, that's very well documented. And so ever since I was the governor's chief of staff, we've been storming that hill trying to get the CON requirement repealed in South Carolina, but we never got a bill out of committee because hospitals are extraordinarily powerful. Existing healthcare providers are extraordinarily powerful. Earlier this year in January, the President of the Senate, Thomas Alexander, and the Chairman of Medical Affairs Committee, Danny Verdon, said to me, we want you to take this bill, get it through the Senate, take it over to the House, muscle it through the House, go down there and convince the governor that it's something we should do. Long story short, that was in January, and on the last day of legislative session in May, we got it finalized, we got it passed, we got it sent down to the governor. He signed it into law, and South Carolina became the 13th state that has repealed CON.